Hello everyone, Assalamu alaikum, a very good morning. Can you hear me?
Morning,
Morning,
doctor.
doctor.
Hi, doctor. Hi,
Oh,
doctor.
yes. Well, okay, thank you. All right. You can see my slide. Can we start now?
Yes, doctor.
Doctor.
Okay. All right, so we continue from our previous lecture, which was about conception, pregnancy establishment, and also embryogenesis, right? So as you remember, we have seen how a conception is established, how that conceptus continues to develop in the process of embryogenesis and gets itself completed with that process to become an independent individual, right? And that is what we call a pregnancy period, right? Starting from the establishment of conceptus with the zygote until the end of the intrauterine life, until it is born to become an independent individual. That period, we refer to that as a gestation period or a pregnancy period. So during pregnancy, obviously, there will be a need for us to know whether that animal has actually established a viable pregnancy or not after breeding, right? And this is a very important part of reproductive management in breeding programs or in farms. So we start by discussing a bit on the main objective or the purpose of conducting pregnancy diagnosis in a given farm, all right? So one of the things is for the purpose of detecting those animals which are not successful during the breeding program, so that they will be identified and they can be recruited back again early before it is late for another breeding program, right? So that's one of the main purpose. So we don't need to waste time and also money for keeping an animal without being productive, without getting the animal pregnant. So that is one of the main purpose of having this pregnancy diagnosis in your reproductive management program. So the second important purpose is obviously to properly manage the pregnancy. So once you know that the animal is pregnant, then you need to prepare very well so that the pregnancy will be maintained until term in a proper way, all right? So one of the most important thing that you'll be able to benefit is you'll be able to know what kind of nutritional management that you can be able to provide to this animal, all right? So the nutritional requirement of a pregnant animal is obviously different compared to that of an animal or a cow which is on a different reproductive status, a non-pregnant cow or maybe lactating cow. So accordingly, you can adjust your feeding regime with the pregnancy, and that is possible only if you know that the animal is pregnant. The other important purpose of doing this pregnancy diagnosis is, once you have established pregnancy in a given animal, then you cannot be very sure that this pregnancy will be sustained up to term. It can happen, in the middle of the period, the pregnancy might be terminated, or abortion can happen due to several different reasons. So for you to make sure that the pregnancy is maintained, you need to check the status of this animal, even after you know that initially the animal is pregnant. So that is another purpose, to make sure that the pregnancy that you have checked initially and confirm it is actually sustained until term. So the other purpose is, due to identify those animals which are not capable of getting pregnant, meaning that it will help you to make a decision on culling. So there are animals which are not performing well, which are not able to conceive, or there are kind of animals which we refer to as repeat breeding animals or repeat breeder cow, for example. So those kind of animals are not economically feasible to keep them in the farm. So at some point you have to make a decision. So that one, for you to be able to decide and to kill this animal, you need to at least assess and evaluate this animal by giving a trial. So after 3 successive breedings, if this cow is not able to achieve pregnancy by checking, every post-breeding period, then you will have to decide to kill this animal because there's no benefit to keep this animal except loss. So that is another advantage or purpose of having pregnancy diagnosis in your reproductive management program. So many other purposes will be there, but these are the main advantages or purpose of performing a pregnancy diagnosis. Okay, so talking about the purpose, if we have seen that those are the benefits that we can be able to achieve by employing pregnancy diagnosis in your breeding program, in your reproductive management. But of course, we need to know how we can be able to perform pregnancy diagnosis. What kind of methods do we have, right? So these are some of the list of options that we have and that can be applied to diagnose pregnancy in animals. So one of the things is obviously observational, non-return to estrus is one of the methods. And then we have visual appraisal. This is something that you can observe from a distance, looking at the different changes in the body. And also we have what we call this ballotment, all right? And then we have the transrectal palpation, particularly for large animals. We have ultrasound scanning, which is applicable for all species of animals. And we do have also, hormone assay, analyzing the hormones related to pregnancy also can be applied. And then we have also pregnancy-associated proteins. In addition to this, which is not listed here, you can have also radiography that can be applied to diagnose pregnancy. So we'll see in a bit more detail each one of these methods subsequently now. So non-return to estrus, all right? So we all understand that, for example, for cattle, we have got an average time period of the estrus cycle, which is elapsed for 21 days. So this 21 days average cycle, it keeps, repeating itself as long as the animal is open or it doesn't have pregnancy, all right? So what happens is during pregnancy or after you inseminate or you breed the cow, so we expect that this cycle will be halted for a moment until the pregnancy finishes. That expected estrus to be seen after 21 days of the first estrus that you have seen and that you have used for breeding will not be coming back again. So that is a principle. If you think that this cow is successful with that breeding program. So what we can do here is after you breed the animal, whether it's natural mating or whether it's artificial insemination program, sorry. After that, you wait for 21 days. And then after 21 days, if this cow doesn't come back to show heat, we understand that this cow is already pregnant. Because of the pregnancy, there will no any resumption of another cycle coming back again. All right. So this is one of the methods of the pregnancy diagnosis that can be used, but of course with several limitations. It's not really a very accurate kind of method, and the inaccuracy is due to many other factors, including the problem of what we call the silent heat. Which is common in cows, meaning that silent heat means the cow is able to cycle, is able to ovulate, but it doesn't show actually the behavioral manifestation of the estrus sign. So I hope you understand what estrus sign means, the behavioral expressions of the signs of heat that is exhibited by a cow on heat. So this is one of the challenges. Another factor could be the problem with the ovary. So if you have got any ovarian disorder, including like cystic ovarian disease problem, for example, if you have a case of luteal cyst, we don't expect the cow to show heat sign, right? So despite the animal is not pregnant due to cystic ovarian disease problem, then you may think that the cow is not showing heat sign and you may think that's pregnant, but actually not. So another factor could be irregular cyclicity. This could be related to hormonal imbalance within the body of the animal, which can be related to other factors, including nutrition, environmental stress factors like heat stress. Many other factors can destabilize the hormonal balance in the body. So this problem also can lead to a miss or a false positive kind of diagnosis or inaccuracy of non-return to estrus using this method as a pregnancy diagnostic method. So as you can see here, if a cow is seen like this after 21 days of post-insemination or post-breeding, then what do you think? So we are going to presume or understand that this cow is not pregnant, because this is the most definitive heat sign that you can see in a cow showing estrus that is tending to be mounted. So after 21 days post-AI, if you see the cow is behaving like that, being mounted by another cow or another animal in a standing or in a standstill position, then definitely this cow is not pregnant. So she's coming back again for another cycle. You have to plan for another breeding, another insemination from this time onwards. So another method is visual appraisal. This is a layman method that can be done by usually farmers during the late stage of pregnancy. So very limited, significance, because when we talk about pregnancy diagnosis, it is during the early stages of pregnancy, the diagnosis is going to be very much important. So because of the economical aspect, because you need to identify that cow that is not pregnant so that it can come back again for another breeding program before it's too late and before you wasted a lot of money and before it costs you a lot. Otherwise, if you are waiting until it becomes late stage of pregnancy for you to see and determine whether this cow is pregnant or not using a method like visual appraisal, then that will be really not economically feasible, not a wise method also to be employed. Another method is external ballotment. This is, again, a method that can be applied during the late stage pregnancy. So meaning that this is really relatively less advantageous kind of method. And of course, it needs also experience. So technically, what you will do is you will be doing a jabbing kind of action by using your fist of hand at the lower right abdomen, which is cranial to the adder, as you can see here, but it should be on the right side, not on the left side here, okay? So from the right side, cranial to the adder, bounded by the dorsal or the caudal aspect of the ribs from here, and then from the caudal vein. This is the mammary gland vein. So what we do is by doing that jabbing using the fist upwards, so you will be like creating kind of wave motion, all right? And at some point, if you suddenly stop and you try to feel, then the ballotment of the fetus is expected to be filled by your hand, which is pressed against the abdominal wall. So technically, that's how we expect to perform it and to fill it. But as I said, this is, again, a method which is applicable only during the advanced stage of pregnancy. The other method is transrectal palpation, all right? This is one of the most important methods that we have, and which actually requires training and also establishing the skill, the confidence. But with confidence and the skill, you'll find this is one of the most practical methods of pregnancy diagnosis. So it is a low-cost, rapid and accurate method with experience. It's low-cost because you just need your hand, all right? And you can be able to do it at anywhere, at any place, all right? And at any time. So that is what makes it very much, economical as well as effective method of pregnancy diagnosis. And it is also safe, both to the dam, to the fetus, as long as you do it with a systematic way and with the gentle manipulation. So it can be also be able to, it can be used to diagnose pregnancy even early during the pregnancy period or during the gestation period, as early as, the 30 days post-AI, which is very early. I mean, we can say this is early detection. So the time that you'll be wasting before you diagnose with this cow whether she's pregnant or not, and for you to decide to bring her back again for another breeding if she's not positive will be very short if you are using this method. So, and the good thing is the accuracy of using this method for pregnancy diagnosis also increases with the stage of pregnancy. So as you go up, in the midterm period or the last trimester, then the accuracy of the pregnancy diagnosis using this method will be higher. All right, but of course it will be challenging when you are using this method to the early stage pregnancy. So what it takes for you to master this technique, or what are the things that you really need to understand to master the technique for transrectal palpation? So one of the most important thing is for you to understand the anatomy of the reproductive system of a non-pregnant cow. So during non-pregnant situation, you need to know how the cervix feels, you need to know how the uterine body feels, and you need to know and understand also how the uterine horn and the ovary will be feeling, all right? So it's only then you can be able to appreciate, the change that will come together with the pregnancy along the track, all right? So one of the most important thing is for you to understand the reproductive anatomy by palpation per rectum when the cow is not pregnant. The next thing is, of course, to relate the findings associated with the pregnancy. So when you have a pregnant case, then what will happen to the cervix? It could be in terms of location, in terms of structure, consistency, there will be a change. And at the level of the uterine body, again, you will have a change. Same is true at the level of the ovary. So we have to understand what kind of expected change will be there during pregnancy. In addition to that, the anatomy of the body of the animal, especially pertaining to the pelvic region, is also very important. You talk about osteology, it is quite crucial, meaning that especially the pelvic anatomy is quite important. So you got to know the pelvic bones that make up the pelvic cavity, in which most of the time you'll find the reproductive organs located, especially when the cow is not pregnant, and also the pelvic brim. The pelvic brim is a part of the pelvis that is creating, the boundary between the pelvic cavity and the abdominal cavity. So usually your pregnancy diagnosed by a rectal palpation will be playing around within these two cavities, the pelvic cavity and the abdominal cavity. So you should have a good understanding of the anatomy of the pelvic cavity. So procedure-wise, how we conduct, we perform the technique. So basically, the first and the most important thing is restraining for the safety of the cow, for the safety of the person who is doing the palpation. And the next thing that you will need is, of course, the rectal gloves. Okay, rectal gloves will be there. So you need to get the proper rectal gloves. And then, of course, you need to have also a non-irritant lubricant. So to be applied on the glove, on the rectal glove, before you enter into the rectum. So, communication is very important with the cow, especially during palpation per rectum. Don't just suddenly come from behind and surprise the animal, and which could even may trigger a reaction which can be disastrous for you. So try to give in a very gentle kind of back massaging, kind of approaching, communicating, talking to the cow, telling that there is someone coming from behind, making the cow understand that will minimize, the unexpected rough reaction from the animal. So do that. And after that, obviously you have to, proceed to enter into the rectum and do the palpation. So as you enter into the rectum, what you need to do, the next step is to form your fingers in a cone-shaped manner, And after that, you gently manipulate the rectal opening, the anal sphincter, to enter into the rectum. So as you enter, Some of them might be a little bit tougher. You know, the sphincter might be very tight. So you just do a rotational kind of manipulation, right, as you go inside while you are pushing forward gently. And then after that, you will get access into the rectum and shouldn't have much difficulties after that. And what you need to do before this is, of course, you need to make sure that your fingernails are trimmed very well. So we don't have to have a prominent fingernails, as it can lead to damage, or it can cause injury to the rectal wall during manipulation, or it can cause even bleeding. So the next step after you get access into the rectum is, of course, to remove the feces. You know, you try to remove as much as possible. You don't have to remove, to the zero limit, but you can just reduce as long as you feel that there is enough space to manipulate. You can just leave the feces above your hand and focus downward to palpate the reproductive organs below the rectal wall. So the next thing is, what you have to take into account is the procedure. As you perform the palpation, what you need to do is you try to do it in a very gentle and systematic manner. Systematic meaning that you have to start from the very beginning. The most prominent structure that you will find in the cervix. Cervix, because it is relatively firm in consistency, and it's also very dense connective tissue structure. So you can be able to locate it easily compared to the remaining part of the tract. So after you get the cervix, you gradually progress forward, to the next part of the reproductive tract, which is the body of the uterus. And then after the body of the uterus, you'll be able to find out the bifurcation, the division between the two horns, the uterine horns. So you have got bilaterally two different horns. So you can be able to assess the uterine horns. And then gradually you continue to reach the level of the ovary. And then you try to check also the ovary, basically for the presence of corpus luteum during pregnancy. That's what we expect to have it. Okay. So that is what we mean by systematic. So once you check all the way from the beginning to the end, then you can be able to make a decision based on the findings that you have. So that is what you need to do at this stage of the procedure. So as a general point, while you are palpating, while you are, checking all along the way from the cervix up to the ovary, what are the information that you are looking for in order to make a good diagnosis? So the information that you are expected to gather can be categorized in general into these three different categories. One of the things is the change that you expect related to the structure and consistency of the various compartments of the reproductive tract. Then the second thing is the content. You will expect also to have a change in terms of content at the level of the uterus, at the level of the ovary. And another important change that you expect during pregnancy is location. So the location of the reproductive organs when the cow is not pregnant is not the same as when the cow is actually on an advanced stage of pregnancy. So that kind of change has to be also taken into account during your investigation. All right, so please bear in mind these three major aspects of your expectation to find. So after you make up that systematic examination along the track, how do you finally make up a diagnosis? When are you going to say that, yes, this cow is pregnant? All right. For you to say this, you should have to depend on these four major findings. So one of them is the fetal membrane slip test. So you need to make sure that there is a fetal membrane surrounding the embryo. So within the uterus, remember that the fetal membranes during the embryogenesis part that we have discussed last week, this week, last week, Tuesday. So we have three different layers of the fetal membranes. From the inner layer, we have got the amnion. Then the next layer between the amnion and the last layer, which is the chorion, is allantoic membrane. So we have the amniotic membrane, we have the allantoic membrane, and then the chorion from the outer layer, which is the one that is, involved in the formation of placenta, right? As we discussed last lecture. So we have to check whether we have these fetal membranes or not. So that is what we call fetal membrane slip test. The next thing is to check for the presence of the amniotic vesicle. So this amniotic vesicle is actually including the embryonic proper, the embryo itself, and the amniotic fluid that surrounds the embryo. So together, the amniotic vesicle. So this is an important parameter to be checked during the early stage pregnancy, all right? During especially the number 1 and number 2, these are very important and relevant findings to be checked during the early stage pregnancy. So number 3 is a fetus, obviously. Remember that intrauterine life has got 2 different periods, the embryonic period and the fetal period, right? So the embryonic period for cattle is usually around 42 days. And after that, we're going to consider that as the fetal period until the end of pregnancy. So the presence of fetus is another expected finding. That's something that you have to look for. And if you find the fetus, then definitely that is a positive pregnancy. Another important variable that you have to look for to ensure that the cow is pregnant is placentums. But bear in mind that as it is for fetus, placentums also, they do not appear during the early stage pregnancy. So it takes time for placentums to be appreciated by rectal palpation, all right, until they become, palpable or until they become easily appreciated by palpation through the rectum. So from that time onwards, then you can rely on getting these placentums being checked and appreciated for you to confirm pregnancy. So as we talk about the fetus, so as I said, it's time dependent. We are talking about during the fetal period of the pregnancy. So usually the fetus will be palpable from day 60 to 90 days when the amniotic vesicle is less turgid. It doesn't mean we don't have fetus before that. We do have it, but because the amniotic membrane and the chorioamniotic membrane becomes turgid during this period, it's difficult to appreciate the fetus beyond the membrane. So even though you do ballotment, and palpation, you may not be able to appreciate but around day 60, this what you call the tension on the wall of the membrane, the fetal membrane, will tend to reduce, meaning it becomes flexible. So when you do ballotment or when you do palpation, you can easily be reach the fetus and you can be able to appreciate the fetus within the fetal membrane. So this is the best time for you to appreciate the fetus. And so the ballotment of the fetus is much easier to do during the 3 to 4 months period. This is during the midterm period. So the first 3 months is the first trimester. So second trimester is from 3 to 6 months. So within 3 to 4, it's very easy to perform this ballotment for the fetus. But it becomes relatively difficult as you go on a little bit advanced from 4 to 7, especially from 5 to 6 months of period. Typically, this period is much more challenging time for us to appreciate the fetus, for presence of fetus, because it drops down to the belly, to the bottom of the abdomen. So it's very hard to reach for you to the level of the fetus to appreciate it. But having said that, you will still have other important pregnancy features that you can be able to find to confirm pregnancy, even though you may not be able to reach to the fetus. One of the things is a placentum. You can just appreciate from the surface. And then the cervix will be shifted cranially to the level of the pelvic brim. That's another important finding. And of course, the amniotic fluid presence within the uterus. As you do the ballotment, you can feel the fluid-filled nature of the uterus. So even if you don't feel the fetus, you will still have many other features of pregnancy that will help you to confirm pregnancy during this time. So this is just a guideline for you, to estimate the stage of pregnancy. Gestational aging is very important, or estimation of the age of the fetus during pregnancy is very important from management perspective or from different views. It's quite important to monitor also the pregnancy, to know the expected date of pregnancy and accordingly to plan, for the delivery time, or to also properly manage the nutrition and other stuff. So it's very important if you know also the age of the fetus. So this is a rough estimation of the age of fetus during palpation per rectum that you can be able to do. So you can roughly assess the size of the fetus once you are able to feel it, and then you will expect to have a size of like a mouse at around the stage of 60 days. Remember, from 60 days onwards, you can be able to appreciate the fetus, right? So by that time, you'll expect a fetal size, which is approximately like a mouse. And then by the 3rd month, the size will increase to a size of a rat. Then it goes to a small cat, large cat. You know, at the 6 months, you'll have a big dog size. And then later on, you will have some additional parameters of pregnancy features that you can be able to appreciate, which includes the 3 meters of middle uterine artery. And this is another, you know, layman kind of, you know, estimating the stage of pregnancy. It doesn't require any skill. So what you need to do is you try to align your hand, you know, your hand against the fetus, and you try to estimate based on that size. And this is more applicable, especially when you have a case of abortion, for example, and a fetus is already expelled out. Then you can be able to estimate by measuring the size of the fetus by aligning against your hand. So you can see here for a 60-day pregnancy, which we said like a size of a mouse, it is going to be like the width of your hand, the width of your hand. And then if you have abortion that took place like around 4 months of period, then you are expecting to have a fetal size that extends from the beginning of the palm side of your hand, from the beginning to the tip of your hand. So the longitudinal axis, this was with the width, but this will be the longitudinal. So is it going to be like a size of a small cat? And then around 6 months of pregnancy, aborted fetus, it will have a size when you bring the 2 hands together, all right, attaching head to head. So the size will be from beginning from this part of the palm until the beginning of the other side of the palm. So this is a rough estimation how you can be able to do, and basically this is more applicable when you have an aborted fetus, but not inside the rectum as you do it palpation, okay? So please don't be confused. This is applicable when you have a fetus which is aborted, expelled outside, not while you are palpating inside the rectum. You can do maybe the first one, but it's not easy to fix the fetus, you know, and be, you know, to align with your hand so that you can be able to, because it's mobile and within a fluid content. Placentums, these are one of the other cardinal signs of pregnancy, as I mentioned. You should be able to find so that you can be able to show that there is pregnancy. But as I said, you will not find these placentums all the way from the beginning to the end of the pregnancy period. But the time that you can be able to appreciate by palpation per rectum is going to be like 75 days post AI or post breeding, or at 75 days of pregnancy. Starting from this time onwards, then you can start to expect to find placentums. And the size is expected to increase as you go along with this gestation period. But when it comes to staging, you can be able to measure the size of the placentums, but the accuracy of fetal staging or fetal aging is not that much. It can be still applied. That is, but the accuracy may not be as high as 100%, right? You may need to combine with additional parameters to get a better estimate of the age of the fetus. And that is, of course, by using other methods like ultrasound for exact measurement. We'll come to that later on. But roughly, this is what you expect, the size of the placentums. So as we are in the end of the first trimester, the 3rd month of pregnancy, we're expecting a 1.5 by 0.5. measurement of size of the placenta. And then at the 4 months, we have 1.5 by 2.5. And then when it becomes 5 months, we have 3 by 2 or 2 by 3. And then by 6 months, we have about 6 cm, the height. This is the height of the placenta. And near term, you will expect to have a maximum of around 13 centimeter height of these placentums. So this is for rough estimation. And as I say, the variation is there in terms of the stage of pregnancy, as well as variation between breeds of cattle also will be there. So when we talk about staging, while you are performing transrectal palpation, these are some of the additional variables that you should take into account to help you to come up with a better estimate for the stage of the pregnancy. So one of the things is cervix and uterus location. So the location is very important, but you can be able to tell the best location for all of these compartments if you are able to understand the anatomy clearly, the one that I mentioned to you, the pelvic anatomy. If you know the pelvic brim clearly as you palpate through the rectum, then it will be very easy for you to tell where the cervix is located, where the uterine body and the horn is located. So that will be very easy to tell. So please refer back to your basic anatomy for the pelvic cavity and also for the reproductive tract. And the thinning of the wall of the uterus as the stage of pregnancy advances is another important, additional important information that can help you to estimate the stage. The size of the uterine horn, it can also, help you to get a better idea as to the stage of pregnancy. The presence of fluid in the uterus, how much fluid you have inside, the asymmetry of the uterine horn, because when there is a gravid uterus, the non-gravid part of the uterus will be different in terms of size from the gravid portion. So during pregnancy palpation by rectum, through the rectum, you will be able to appreciate also the difference in the size between the two parts of the uterine horns. Another thing is fremitus of uterine artery, but you need to be very careful because especially during the hottest day, when the cardiovascular system is very active, you will feel so many other arteries in the region to feel like, pulsation. So to make sure that you are actually talking about uterine artery for you to tell about the fremitus of uterine artery, not other blood vessels in the region, leading to a misinterpretation and misdiagnosis. So this is a table which will give you an idea what will happen to the various parts of the reproductive tract at different stages of pregnancy until around 5 months of pregnancy. So I leave this to you to read it and understand. Is more or less what we have discussed so far, but in a summarized form, in a table form. So for the ovary, obviously what we expect basically is the presence of corpus luteum. Corpus luteum is very important for the progesterone to be released for maintenance of pregnancy. So that is one of the most significant findings during pregnancy that you expect from the ovary. Side of the uterine horn, as I mentioned, it will change over time. This is the estimated size, and also for so let's talk about the other method of pregnancy is ultrasound. Last year, I think, part of the course, ultrasonography for reproduction. But of course, also a little bit. So we talk about ultrasounds, commonly used examination is the beams that we obtain is that it can help you earlier than even just discussed before, right? But using pregnancy even so around 21, 25 detect that can be able to check. So the ultrasound or pregnancy choice or not. But one of the technique is obviously is called at any time. So be able to ultrasound everywhere. Spend money, invest. Dealing with a huge farm business could be, but because
Doctor,
you can be able to cost and checked for.
Doctor,
Yes.
Doctor, sorry to interrupt,
Hello?
but
Yeah.
Doctor's voice is actually breaking. Hi, Doctor. Yeah, Doctor's voice is breaking, so we couldn't understand what you were saying, Doctor. So sorry.
It's just now or before? Hello?
When Doctor started explaining this slide,
Oh, okay. Okay. Can you hear me now? Maybe internet is. So can you hear me now? I know there is something.
you're still breaking, Doctor.
Hello? Can you hear me now?
Yes, Doctor.
I'm trying to restart the internet, so I don't know if it makes a difference. My slide is still visible to you?
Yes,
Yes,
Doctor.
Doctor.
All right, okay. So, yeah, so I'm talking about the ultrasound as another method of pregnancy diagnosis here. So I was mentioning just now that this is relatively, a better choice of pregnancy diagnosis because it can provide you the advantage of detecting pregnancy as early as 21 to 25 days of pregnancy, which is compared to rectal palpation even much better, right? Which is around 30 days of pregnancy, which I mentioned before. So, and it gives you relatively the most accurate method in terms of examining the ovary, as well as detecting twins, and also, sorry, also in terms of checking the viability of the fetus. So viability, like by 21 days of pregnancy, you can see the heart beating. Remember, during embryogenesis, I mentioned that cardiovascular system is one of the earliest organ system in the body to be established during the embryonic life. So around 21 days to 23 days, you already have the heart being formed and pumping, you know. So you can see the heart beating during that time. And by then, you know, you are able to know the viability of the fetus, not only the presence of the embryo. So this is additional advantage that you can obtain by using ultrasound as a diagnostic tool for pregnancy. I hope it's still okay, huh? Hello?
Okay, doctor.
All right. So, but again, the drawback with this method is the cost, obviously, is not available everywhere as your own hand for rectal palpation. So that is something considered as a disadvantage. So technically, as I mentioned, this has been part of your diagnostic imaging course last year, and it's just like a kind of revision, so you know it. We have different types of probes, linear, convex, and largely in terms of large animals, like especially cattle, we rely more on the transrectal scanning using a linear probe. Okay, you can use a high frequency probe during this method. Transabdominal is relatively very less commonly applied and not really a good approach or a good method of scanning for cattle especially. So, but it can be applied, but during the advanced stage of pregnancy. All right, so this is just an example how you can be able to perform transrectal ultrasound scanning for cattle. And this is an example of different, stages of pregnancy in cattle. Like day 25, you can be able to see a dark amniotic fluid content inside with a very small embryonic vesicle. You can see the amniotic vesicle over here, showing you a hyperechoic structure, which is representing the embryonic proper, surrounded by the amniotic fluid. You can see now the extension is going on, and the fetus is also getting elongated. I mean, the embryo. You can see from crown ramp length here, from the head to the tail region at day 35. So you can see that by day 25, you can even able to detect. So as it goes on, you can see the embryo being differentiated to become a fetus. So now you can see organogenesis completed. You can see the different parts of the body, the head, the eyes will be there, the limbs, the body, the trunk, and so forth. So you can be able to get the details of the information by using this ultrasound method. For transabdominal method, as I said, is not a common method. And if it is applied, it's going to be during the late stage or advanced stage of pregnancy, which is more than 6 months of pregnancy. And this is the area, the location where you can be able to scan abdominally. So this is just, cranial to the stifle joint, bounded by the linea alba from the bottom and caudally from the ribs. So this is the area where you can perform the scanning. And this is an example of a transabdominal scanning image from an 8-month pregnant cow. So you can see, the placentums are visible, the amniotic fluid, allantoic fluid is also can be seen. The fetus also is somehow visible, but not in detail. But this stage is already late, it's not a time that you will need ultrasound. Okay, so that is the main thing that you have to take into account. We need a method that can help us to detect, and also an approach that will enable you to detect the pregnancy much earlier, not at this time. So in the case of horses or in mares, you can be able to also do the pregnancy diagnosis by transrectal examination as well as transabdominally. Transrectal, the same principle as I mentioned for cattle. Transabdominal is more applicable in mares, like in ponies especially, and it can be done, right from the beginning of the midterm period. Midterm pregnancy, like 3-4 months period, can also be detected by using the transabdominal approach. And like cattle usually you have to wait until like 6 months during the last trimester. For small ruminants, like for sheep and goats, we do have also the two approaches. the transrectal using the linear probe is advantageous to be used during the early stage of pregnancy, like during the first 1 month of pregnancy until like 40 days. But as the stage of pregnancy advances, transabdominal will be the choice, the best choice, using a convex or sector probe with a low frequency or megahertz of probes. So, but both methods can be applied in the small ruminants. So this is the approach, how you'll be performing. Remember that the main difference with the probe design compared to the large animal transrectal probe is you got to have this fixed handle from outside to be used for, manipulating the probe within the rectum, because you cannot enter with your hand into the rectum in the case of small ruminants. This is an example in the deer. And this is another example of doing transabdominal scanning in a goat. Okay, now that is for pregnancy diagnosis. But again, knowing the stage of the pregnancy or estimating the age of the fetus is also very important for similar reasons that I have mentioned before. And remember, during transrectal examination, you may be able to estimate also the stage of pregnancy by, taking into account the number of different parameters, right? By trying to estimate the size of the fetus, by looking at the location of the cervix and the uterus, where they are located, thinning of the uterine wall, size of the uterine body and the horn, and all these parameters can be used to approximately stage the pregnancy. But by using ultrasound, you can have a better opportunity, to estimate the stage of pregnancy in relatively much better accuracy compared to that of the transrectal palpation method. So here there are many different parameters that can be measured and can be used to estimate the stage of pregnancy. So this includes the CRL, which is the crown ramp length, the length from the head up to the tail of the body of the fetus. And this is the head diameter, all right? This is the head diameter, which is also known as the biparietal diameter, BPD. And we have the length of the head also, measuring from the tip of the nose up until the pole on the head. And we have a trunk diameter at the body part. You can just measure the trunk. The diameter of the eye, the orbit of the eye also can be visualized by ultrasound scanning. And you can be able to measure also the diameter of the eye. And on top of that, the placentums also can be measured for their size and can be related to the stage of the pregnancy. So the more parameters you include, the better estimate will be the stage of pregnancy. So, but if you depend only on a single factor, probably you will have a less accurate estimation of pregnancy. So additional importance of using ultrasound is fetal sexing. So you can be able to also know the sex of the fetus, especially in cattle, is best done around day 60 to 70 days of pregnancy. So also in small ruminants can be done, but might be relatively difficult because of multiple pregnancies and a small size fetus in the case of small ruminants. But this is, again, additional advantage of using ultrasound. And you know that knowing the sex of the fetus will have a different market value of the cow which is pregnant, because of the sex of the fetus that she is carrying on. Moving on to another method, which is the hormonal assay method. There are different types of hormones, produced during the time of pregnancy. Remember, placenta is one of the endocrine tissue that is known to produce also kinds of hormones. In our past lecture, if you remember. So progesterone, it can come from placenta as well, depending on the species of the animal, is one of the common hormone that is assayed or analyzed to determine pregnancy in different species of animals. So you can be able to take different types of body secretions as samples to be analyzed for progesterone. These samples include milk if the cow is lactating, but if it's like heifer where you don't have milk samples, you can take the blood sample. Serum or plasma can be utilized to determine the concentration of the progesterone. So this progesterone level, the time to be taken, and of course the concentration will be variable. So the best time to be taken is during 18 to 24 days post-AI, after breeding. all right? Because that is the time that you are expected to have a corpus luteum to be maintained to support for pregnancy, right? So during this period, if you are able to get a progesterone level which is higher and sustained, then we are going to consider that animal has already established pregnancy. But if the progesterone level drops down to the basal level, then we consider that animal is not pregnant. So having said that, this method of pregnancy diagnosis, it comes with a lot of disadvantages, right? Despite the fact that this is a very highly sensitive method to detect progesterone level in the blood or in the milk sample, but it's not a specific method, meaning that you can have a progesterone level which is high, but not necessarily due to pregnancy. So it can be due to other issues. It could be due to even a reproductive disorder. For example, if you have got a cystic ovarian disease with CL as the luteal cyst, obviously you will have high progesterone level. If you have a pseudo pregnancy, if you have a pyometritis, so you can have also high progesterone level. So a lot of differentials will be there, making the diagnosis of pregnancy using this method difficult. So this is just an example to show you how a pregnant animal and a non-pregnant animal after 21 days post-mating will have in terms of progesterone profile. So we expect after breeding, the corpus luteum will start to establish and then continue to produce progesterone, right? So, but if this breeding doesn't yield conception, then obviously the cow will come back to another cycle, meaning that the corpus luteum will regress and progesterone will drop down to the basal level. Another cycle will continue. So your sampling during this time period will show you a low level of progesterone. Whereas in the case of pregnant animal, after breeding, the corpus luteum starts to rise. I mean, the progesterone level rises up and then will be sustained. It's not going to drop after 21 days because of the conception and because of what? Maternal recognition of pregnancy, the MRP. Remember that during our past lecture. So this is how the measurement will show you the difference between a pregnant and non-pregnant animal. So another method of pregnancy diagnosis is also by measuring pregnancy-associated proteins, production of these proteins usually by the placenta. So one of them is this pregnancy-specific protein B, which has been commercialized to be used for testing. And you can use, similar to progesterone, you can use serum samples to analyze using ELISA. And this method is accurate to detect progesterone level and also diagnose pregnancy from day 30 post-mating until the end of pregnancy. But one important thing here is the level of this pregnancy protein B, it doesn't drop at the time of parturition. It still is maintained until day 80 postpartum. So this is one of the drawbacks with this test, because like postpartum cows, we expect them to be breed, by day 60, right? So by then, around day 80, we expect the progesterone level to be high. But if you, and at that time, we also expect this pregnancy-specific protein B to be high, but it's going to be like a false negative, false positive test if the cow is not pregnant during this time. So that is something we need to take into account. But at the same time, another major problem with this test is it can be very costly as well as time consuming, because you have to order like the kit to get, and then that getting the kit also will take a lot of time to get it delivered to you before you analyze the sample. So in summary, considering the various objectives of performing pregnancy diagnosis listed down here, to be as accurate as possible, up to 100%, and to avoid any false positive or false negative cases, and be able to determine the pregnancy as early as possible after breeding, and of course also the ability to estimate the age of the fetus, determining the conceptus and the sex of the fetus. Considering all this and considering the cost of the procedure that you are going to rely on for the pregnancy diagnosis, you will find that transrectal palpation is the easiest, fastest, and relatively the cheapest method to achieve most of these objectives. So meaning that a lot of effort needs to be done to make sure that your palpation skill, your rectal palpation skill for pregnancy diagnosis is good, is good. All right, I think that's the end of my lecture for today. I don't know if we have left any time. No, it's on time. It's already 12. So if you have got any questions, as I said before, you can drop it into Putra Plus, or you can email me, then I can respond to you, or you can raise it anytime in future. All right? So see you with another lecture next week. So I hope the sound system was okay, right?
Yes, doctor.
Until the end of the session. All right, thank you.
Thank you, doctor.
You're welcome.
Thank you,
Bye.
doctor.
Thank you, doctor.
Welcome.
Thank you, doctor.
Okay.
Thank you, doctor.
Welcome.